Welcome to 340B Leaders Up Front, a monthly podcast from 340B Report. I'm Anna Mangum, host of this podcast, which showcases a fascinating, dynamic, and consequential area of the 340B drug pricing program, the industry-leading firms that support 340B providers in carrying out the program's mission, and the senior executives who help lead them. If you listened to prior episodes, welcome back. We know you'll enjoy fresh new content and hot takes on current and emerging challenges in 340B and how major product and service providers are innovating to meet them. You'll also learn about the 340B career trajectories of the seasoned leaders of these firms and gain their valuable insights. If you're not already a subscriber to our news service, I encourage you to subscribe to 340B Report by going to 340breport.com and using the coupon code podcast25 to receive a 25% discount. In this exciting new episode of 340B Leaders Up Front, I chat with two senior leaders at RxParadigm, Tim Nalen, Chief Operating Officer, and Lauren Reese, Chief Strategy Officer. RxParadigm is a pharmacy technology solutions provider developing what the firm describes as the first neutral 340B claims clearinghouse. Tungsten Plus is a new system to resolve duplicate discounts and other pricing discrepancy challenges, something that many in the 340B community believe could be a game changer in resolving one of the most hotly debated challenges in the 340B program. RxParadigm is an Ultra Diamond sponsor of 340B Report, the highest level of sponsorship. We're very grateful for their investment in 340B Report. Today, we'll learn more about Tim and Lauren, the valuable offerings RxParadigm provides, and Tim and Lauren's perspectives on a variety of hot topics in 340B. Welcome, and thank you for being with us today.
Happy to be here.
Thanks for having us.
Well, let's start with Tim. Welcome back to 340B Leaders Up Front. For those of you who missed our previous conversation with Tim last year, can you tell us a little bit about your life before 340B, including where you grew up, currently live, your educational background, and anything else you think might be helpful to the listener?
Yeah, sure. Well, great to be back, first of all. I am from New Jersey originally, so right outside of Trenton, New Jersey to be exact. And I currently live in Philadelphia, Pennsylvania, or right outside of it, with my wife and two daughters. And I went to school at the University of Delaware, so I've lived in the tri-state area pretty much my whole life. Delaware, Pennsylvania, and Jersey is what the tri-state area is called. But I spent most of my career in what's called managed IT services and support. And I've done that across a range of different industries. And as you kind of alluded to, I had two separate stints at large pharma companies. So I had direct experience working in those environments. So thanks for having me.
Oh, thanks so much. Great to have you back. Lauren, I know you and a number of your family members have made a career in the 340B area, which is unusual. Can you tell us more about that?
Absolutely. It's funny, actually. It's really been a 340B has been a family business for us. My dad started in the space years ago, working directly with covered entities and pharmacies. And over time, my brother and I got involved. What's really cool to watch is now the next generation is actually coming into 340B. So that's been interesting. For me, what's always really stood out and what's kept me here is that 340B sits at the intersection of policy, patient care, and real operational execution. It's not theory. When it works well, it directly enables providers to expand access to care. But getting there isn't easy. So for me, it requires navigation, navigating fragmented systems, evolving regulations, and really putting a lot of effort in automation of manual processes behind the scenes. And so that makes the space both challenging and meaningful for me to be a part of.
Well, thanks, Lauren. Yeah, and I'm sure we're going to hear more about that as we can continue here in our podcast and learning more about your firm. Tim, you mentioned you started your career in tech, including, but not limited to, a stint at a drug company. What were some of the key areas of focus for you, and how did you find your way to 340B?
Yeah. Well, as I mentioned, the last 15, 20 years or so is more managed IT services. So if a big international company outsourced their IT, I'd be part of that team it was outsourced to. But I started my career in pharma actually as a software developer, so IT. And I was actually on the manufacturing side, so helping to automate the actual plants that make the drugs. So the bats and the pipes and the valves that had to work to kind of make the drug. I was part of those teams automating the plants. From there, I moved into the R&D part of the pharma companies. So the ones that actually design and develop the new drugs being taken to market. And then I pivoted to IT managed services. And how I got to 340B is not a very interesting story. I would say our CEO, Mesfin Teganu, and I share a mutual acquaintance who connected us together, and we gelled very well. We have complementary skill sets. He's more the visionary. I'm more the meat to potato kind of guy. And I've been learning and experiencing 340B ever since.
Well, thanks. That's an interesting background. Lauren, you're a seasoned C-suite 340B business process and operations executive with leadership stints at some of the most respected 340B service companies. Tell us about your background and your career trajectory.
My career's really been centered around everything from taking an idea from concept all the way through execution in especially complex and highly regulated environments like 340B, where I've been for decades at this point. But I've spent most of my time really leading product operations and implementation with a focus on turning fragmented workflows like claims, eligibility, purchasing, compliance into something that actually works in practice and in scale. More recently, though, I've been focused on how to navigate some of the newer evolving challenges in our industry, particularly rebate models, everything that's going on with maximum fair price, which we're going to dig into today, the manufacturer restrictions, and how the reality and impact of the data being spread across so many systems and affects stakeholders overall. I think what shaped my approach really is recognizing that this is complex for everybody. It's not just, one stakeholder that this is complex for. Everybody involved, covered entities, pharmacies, manufacturers, partners. And the goal is really to bring more transparency and coordination to that. So for me, the combination of mission and complexity is really what shaped my career. I've always been focused on building and operationalizing solutions that work in the real world. And so making sure that these programs integrate into what's actually being done day to day to operate them is super important to me and the success I've had so far.
Oh, well, that's inspiring. Thanks so much, Lauren, for that overview. Now, you mentioned all the complexity, which we know is the case with 340B, and the unique aspects of this space. What types of skills or aptitudes do you think, given the kind of problems that people need to solve in 340B, are useful for professionals who are working in this space?
Yeah, that is a really interesting question. There's so many facets of 340B from my lens. I would say that it requires a combination of analytical thinking and operational execution. I feel like it's just not enough to understand policy. You have to understand how the policy actually shows up in data and workflow and ultimately in financial outcomes. So what I've seen is that people who do well in this space really are strong in a few areas. They think in systems. They understand how claims, purchasing, reimbursement, compliance, how they all connect. And they're also really comfortable with data, but not necessarily from a technical standpoint, but in terms of really understanding how to interpret it, question it, connect it across different sources and for different business purposes. And then the last thing I would say is that they're adaptable because the landscape is constantly changing. So whether it's a manufacturer requirement, state activity, federal programs, you really have to be able to adapt. And I think at the end of the day, it comes down to being able to connect all those dots of complexity into something really actionable.
That's terrific. Well, thanks. Tim, let's talk a little bit about RxParadigm. Tell us about the key products and services that you provide to 340B stakeholders and the broader healthcare supply chain. And tell us what makes them distinctive.
So at a high level, we are a pharmacy solutions provider, and we provide solutions across a number of programs. But the common theme across all those is that they directly relate to or heavily intersect with 340B. Now, what we think makes it distinctive is that our real focus is on bringing the different stakeholders together to solve an industry problem. or maybe to effectuate these ever-evolving programs, with Medicare maximum fair price being the most recent example. Because Lauren alluded to it, whether you're a manufacturer or a CE or a pharmacy, everyone is challenged by the complexity around 340B. So everyone needs help in different ways. But to be specific about the solutions that we provide, so I mentioned the Medicare maximum fair price program, which, as many listeners know, heavily intersects or overlaps with 340B. So we provide a service, and our platform services that end-to-end effectuation perspective. We handle manufacturer claim submissions, for example, the ESP submissions and Truzo, especially these new in-house claim submission policies that are coming out frequently. The rebate pilot, if it becomes active again, we would support that. I know we were ready to support our clients on December 31st of last year before it was paused, but we're ready to support them again if, I guess a big if it gets unpaused in the future. Then I'll say maybe finally is our 340B Clearinghouse. So we kind of alluded to it here, but we feel very strongly, and a lot of people in the market do, in the industry, that it's the viable option to solve some of the biggest challenges around deduplication of rebates, Medicaid and commercial rebates, and then deduplication around the Medicare maximum fair price, or MFP program as well.
Okay. Well, thanks. That's a really comprehensive overview. RxParadigm was the first in the industry to publish an article analyzing the accuracy of Medicare fair price claims effectuation in 2026. Lauren, what can we learn from the finding that 40% of MFP claims missed the mark in January?
What these findings really highlight is the program is still maturing from an operational standpoint. When we look at January and saw that 40% of the claims missed the mark, we really dug in to determine where, and it fell into a couple of categories. But a big driver was around timing and alignment between claims processing and eligibility determination, which is just a standard process that happens. But in many cases, claims were processed without complete view of whether they were 340B eligible or not, which has led to misclassification. So really, it showed up in two main ways. One, we saw duplication scenarios where a claim is 340B, but it also received an MFP payment. That creates reconciliation and potential clawback risk as entities work to correct that and self-report their 340B transactions. The second and more impactful was denied payments that likely should have been paid. These were often denied claims based on an assumption that the claim was 340B without the full context or consideration for scenarios like open door pharmacies or carve-out strategies, or cases where the claim simply just wasn't eligible for 340B. So that's where we're seeing the greatest financial impact to dispensing entities, because those claims are being denied. I will mention there's a smaller category that we saw as well, which was short pays, where pharmacies are receiving monies, but they're receiving less than the expected amount. I think the key takeaway is that it's about alignment, visibility, and having a complete view of the claim across the system and the stakeholders. I would add that there is some good news. As we start to look at the next quarter, we are seeing this improve over time as processes like the good faith inquiry and self-reporting processes mature, and as stakeholders get more experience working within the program.
Well, it's good to hear that's improving because it's such an important area. Now, 340B covered entities have been frustrated having to submit data to 340B ESP and Calderos, and have been unhappy in their efforts to get 340B pricing restored. Tim, can you tell us how your platform differs from those clearinghouses?
Our approach is to work with all stakeholders. Again, that's a common theme, right? We work with CEs, dispensing entities like pharmacies, the government, pharma, to offer a solution that meets the needs of all the different stakeholders, not just some of the stakeholders. And we built platforms that support and help these stakeholders through these challenges. But what I would add is that, you're right to call that out. There's more and more platforms popping up, right, with different requirements, different submission standards, different manufacturers on different platforms. So when you're one of our clients, what we do is we capture your data from your various different systems. That can be your internal systems, TPAs for contract pharmacy, for example, to help you and automate the submission of that data across a range of systems. So you called out ESP, you called out Calderos, which is Truzo. There's Beacon for MFP. There's MTF. So the one-time setup, we help clients automate that process and integration, data integration and process-wise.
Okay, great. Well, thank you. Now, you've developed, RxParadigm has developed partnerships with state primary care associations and other 340B provider stakeholders. Tim, can you tell us more about these relationships and what type of work are you doing for covered entities in states like Oregon?
Yeah, Oregon's probably our most famous example, so it's probably worth diving a little bit deeper into that one. So at the time, Oregon legislature was looking to implement a requirement that CEs and their pharmacies would have to put a 340B indicator on not just Medicaid claims for 340B, but commercial or private insurance and Medicare claims as well, which had a significant administrative burden to these pharmacies. So as an alternative, that legislation allowed for 340B claims data to be sent to a clearinghouse for pharma and PBMs and other folks that need access to that data to help deduplicate, get access to that information in a safe way. So with that language put into that bill, we became the clearinghouse in Oregon for those claims. So we're getting 340B claims from various CEs and pharmacies and helping be that bridge to safely and securely share data without giving away any sensitive data, but allowing PBMs and manufacturers to not pay duplicate discounts or double payments on the rebate side.
Well, that's a great partnership. Lauren, are there areas where your clients are particularly needing some help these days?
Absolutely. And Tim sort of touched on it a bit, so we'll dig in a little bit. But right now, there's really most of the demand is coming from two main areas. The first is around the end-to-end MFP workflow that we've been talking about quite a bit. Clients are trying to track eligible MFP claims versus 340B claims. They need to reconcile payments from the MTF, manage good faith inquiries when something doesn't line up. And while these processes have started to work, they're incredibly operationally heavy. So unfortunately, it's not just about the timing of the payments, it's about what it takes to actually resolve a claim and dispute. The level of evidence that's being requested isn't always intuitive to how these programs operate. And so pulling all of that together, whether it's purchase data, claims level data, or supporting documentation across systems, is a significant lift for covered entities. So where we're seeing the biggest need is in supporting that full workflow, collecting and organizing the right data, submitting and tracking the evidence, and then ensuring that payments are reconciled. And any necessary adjustments or self-reporting and that stuff is accounted for as well. The second area, and Tim touched on this as well just a little bit, is around the increasing manufacturer requirements, particularly related to the need for in-house pharmacy submission of pharmacy and medical claims, along with just broader data expectation. It's really creating additional complexity because, again, it introduces new workflows on top of everything else. And often it's requiring data that's not easily accessible or is across multiple systems. So across both of these areas, I think the common theme that we're supporting our customers with is really around the coordination, having clear one system, audible processes that brings together data, workflows, and outcomes across multiple stakeholders.
Well, there's definitely a lot of moving parts in just one of the areas, right? Let alone several that folks are having to focus on. You mentioned the rebate earlier, the rebate pilot. As you know, the Health Resources and Services Administration, HRSA, has resubmitted its proposal for a rebate program for 340B after its first try was blocked by a federal judge. HRSA has issued a request for information to stakeholders inviting input on whether the agency should implement a rebate model under the 340B program and how best to operationalize any such rebate framework for stakeholders. Comments were due April 20th, so that was just a few weeks ago. 340B providers are working with lawmakers on Capitol Hill to try to block the rebate from going forward, but I know there's a concern from the covered entity community that the rebate pilot could move forward. Tim, how have you been supporting clients in preparing for the launch and now in navigating the uncertainty regarding when this pilot might actually be implemented?
Well, I would first encourage if our listeners have a spare half hour, we did respond to that RFI, so you can go to the government website and check it out. So would encourage listeners to do that. And we respond to that RFI with direct experience with the MFP program launch and the pause rebate pilot launched December 31st. So real world experience for that RFI. Well, I'll go back to what I said before, Anna, which is what we're doing with our current clients that we're running the MFP service with is we're hooking into all their different systems to get ready for the rebate pilot, right? So if you're a covered entity, you might be self-managing your in-house pharmacies. You're using multiple TPAs for your contract pharmacies. What our platform does is acts as a single pane of glass for rebate submission, for payment and reconciliation once the payments come in for the pilot, any disputes that have to get raised, and dispute management, so we're end-to-end effectuation on the rebate pilot. And we're future-proofing our current clients if and when the rebate pilot comes back.
Concurrently, folks have been also addressing the Medicare drug price negotiation program, which went live on January 1st. Tim, how are you supporting clients in simultaneously navigating multiple pricing and reporting regimes?
Yeah, I think the first 4 months have been a roller coaster, to say the least, of the MFP program. So I think Lauren alluded to some of these, but we like to try and simplify it into 4 key areas that we help, right, or are helping. The first question that our clients or any MFP client wants to ask is, which claims are MFP eligible, right? That's question number 1. So our platform, our service does that. From there, the second question is, well, what is the expected payment for every MFP claim? So that's a second thing that our platform does, calculates what they should be receiving based off the fact, for example, if that claim also had a 340B discount applied to it, changes the calculation. The third one and most important is what was actually paid. So we hook into MTF and Beacon and other systems to understand what the actual payment was. And if the expected and the actual don't match, how do they resolve that? With the manufacturer. And we solve that problem as well with our dispute management process. And I'll call out in that dispute management process one interesting piece. So in late January, listeners may know, manufacturers put a new process in place that required the submission of claims to ESP if they dispute a claim as not 340B, if the payment was rejected. We also support that process and all the mapping required to support that, so just as an FYI. The last piece I'll say is that the other navigation piece that people are challenged by is that they're having to work through 3 systems. There's the government system, which is MTF, Medicare Transaction Facilitator. There's the manufacturer platform, which is Beacon. And then there's another manufacturer platform called ESP to submit these claims in the dispute process. So having to interact with all those systems, we take that headache away from our clients.
Lauren, I was going to ask you, what are some of the remaining challenges, as if they need any more, but are there remaining challenges in implementing the new Medicare drug program? And do you have any words of advice for covered entities around how to stay on top of this?
Unfortunately, there are more challenges ahead, I think, Anna. The biggest challenge is that the program isn't static. It's evolving. The maximum fair price program doesn't just stop at the initial list of drugs. More are added year over year. So the real challenge isn't just solving for today. It's building something that can scale, that the increasing complexity is that we see over, year over year. At the same time, this isn't happening in isolation. You've got MFP and potential rebate models that could reemerge, ongoing manufacturer requirements, and broader 340B reform discussions, all layering into existing operations. And all of that depends on data and workflow that sits across multiple systems, internal and external systems, which makes it really difficult to manage and coordinate. So if I had to simplify it, I would say there's really 2 things I'd focus on from an approach perspective. First, build for flexibility and scale, both internally and through the partners you work with. try to avoid point solutions that address one part of the problem today, but really focus on ones that look at solving the problems and evolving over time. So you're not just focused on individual issues of today. Second, I would say focus on creating consistent end-to-end view of your claims and financial outcomes. This means being able to connect eligibility, payments, and any follow-on activity like adjustments or disputes, so you can actually validate what's happening and not just rely on individual systems. Unfortunately, at the end of the day, this isn't just a compliance exercise. It's really a financial one, and organizations need to stay ahead of it. And the ones that will invest early on the right foundation.
Well, those are great words of advice and wisdom. Thanks, Lauren. While not as busy as 2025, there continues to be a lot of 340B action this year in state legislatures. This includes additional states passing contract pharmacy protections and provider reporting requirements. Tim, is this an area that you're helping clients with?
Yeah, it is. I think the Oregon legislation that I talked about before is a clear one, but we provide transparency across different stakeholders, provide reporting requirements, or to help them with the reporting requirements, while valuing, kind of limiting what's shared and sharing data in a safe way. But we have provided, more directly to answer your question, we provided data out of our system to help stakeholders comply with reporting requirements for this past legislation. So that our Clearinghouse is not just a process-driven effectuation program, but it's also a reporting engine for state laws.
Okay. Well, drug manufacturers are trying to impose additional restrictions and requirements to access 340B pricing. This includes more claims data requirements in additional settings beyond the contracted pharmacy setting. And that sounds like a real challenge for 340B providers. These restrictions will likely be challenged in the courts. Lauren, what are some steps that 340B providers can take to mitigate the impact?
Yeah, it's definitely a challenge and one that's evolving quickly. I think the first thing to recognize is that this is complex for everyone. There's a growing need across stakeholders for more visibility and validation, and covered entities and pharmacies are being asked to respond to that with more data, often across many systems, as we've talked about already. And the systems weren't originally designed for this type of support and request. And I think that's equally as important. So from a practical standpoint, there are a few things that I think providers can do to mitigate the impact. Again, and we talked about it a little bit, but to dig in a bit, first, I would focus on getting your data in order and accessible. A lot of the challenge comes from the fact that the data needed to respond, especially for in-house pharmacy or medical claims, is sitting in different systems and isn't easy to pull together. So looking at that and finding ways internally to ensure that you have access to that is a good place to start. The second is, and this is an interesting one that I don't think we talk about enough, is standardizing how you respond to these requests. As an organization, having a standard approach is critical. So even though requirements may vary, having a consistent internal approach to collecting information, to validating it, to what you share from a data perspective really can reduce a lot of the manual efforts and risk. And the third, I guess I would say, is you really have to make sure you have the right tools or partners in place to support that. Not every organization has the ability to pull and connect the data internally. And without that, it becomes very difficult, especially to respond effectively or at scale. So while the broader landscape may continue to evolve, that organizations would be best positioned if they have visibility into their data, repeatable processes and policies internally for responding to those types of requests, and really choose partners that can support them as the industry evolves.
Well, thank you so much. Tim and Lauren, it's hard to imagine that you would have any more words of advice because you've already shared so much wisdom on 340B. But Do you have any thoughts that you'd like to share in closing before we wrap up?
Think about what we've talked about so far in this discussion. We talked about MFP. We talked about potentially rebate pilot coming back. As of this taping, 7 manufacturers now are asking for in-house pharmacy claims to be submitted to them. All this happened in the last 7 to 9 months. So the pace of change is more rapid than it's ever been. So my advice would just be, don't be left behind. Face these challenges, start looking at them, explore internal solutions. If you don't have the manpower or experience, look at outside solutions. MFP is already out on its way, first quarter of the books, and the rest is coming soon.
Lauren, did you want to add to that?
Yeah, I would just like to add that this is a moment where the community really needs to lean in, not step back. There's a lot of challenges, and while it can feel overwhelming, the reality is that this is where we are. So I think it starts with being honest about the level of change and challenge in front of us. And more importantly, recognizing that this isn't something any one of us is going to solve on our own. These are shared challenges, and they're going to require a more coordinated, collaborative approach across our community. We've done this before, guys. The environment was different, but the need to come together to solve real problems and learn and lead through change isn't new for 340B. And if we can get back to that, working together, being proactive, and taking ownership of where things are from here, that's what's going to matter. At the end of the day, 340B has always been about expanding access to care for patients. Staying grounded in that mission and letting it guide how we move forward is what matters most. Thanks, Anna, for having us.
Oh, yes. It's been an absolute pleasure. And thank you for those wonderful closing thoughts. Very inspiring. So thank you again, Lauren and Tim, for joining us today. And to our audience, stay tuned for our next podcast. If you're not already a subscriber, please consider subscribing to 340B Report by going to 340breport.com and using the coupon code podcast25 to receive a 25% discount. It's the best way to stay on top of the latest developments in the ever-changing 340B program. Also, check out our other podcast, Inside 340B Report, to hear our journalists discuss the latest 340B developments.